Lassa fever is an acute viral hemorrhagic illness caused by Lassa virus, a member of the arenavirus family of viruses. It is transmitted to humans from contact with food of household items contaminated with rodent excreta. An acute and often fatal viral disease with fever occurring, chiefly found in West Africa, reports show it is acquired from infected rats. Medical microbiology and parasitology expert at Lagos State University Teaching Hospital, Lassa, Dr. Bamidele Mutiu, explains further.
Lassa fever virus is a febrile disease. That means a disease that you always see people presenting with high body temperature, which is a result of Lassa virus. You know, when people come in contact with the virus, after an incubation period, that is the period between the time you come in contact with the virus and the time the body temperature picks up, in which person now present with fever. That is the incubation period. So after incubation period, which is between 3 to 21 days. But the difference between Lassa fever and other fevers is that at the end of the day, one of the classical signs is that you see people having bleeding, whether on the skin, from their mouth, from the nose, when they are passing urine, when they are passing feces, in every part of the body, they can bleed.
Since the first case of the disease happened in November 2015 in Bauchi, northwest Nigeria, with subsequent deaths reported in 10 states, including Abuja, a perceived calm has been restored. But how aware is the average Nigerian about the disease, or even the local food sellers in the market who operate in an environment where rodents can easily breed?
I know it's a disease that is contacted through rats. That's just what I know about it. And it seems we have had some cases in Nigeria that have been recorded and some deaths. So maybe in Nasarawa and some of the Middle Belt.
The little awareness that I know about Lassa fever, it's a virus, a disease, you know, that's been carried out by probably, I think, rat. Rat is the main cause of it. So, and then it's not good for humans, and then it kills faster than any other disease one could even think of.
Do you know anything about Lassa fever?
Huh?
Do you know anything about Lassa fever? Lassa fever.
Lassa fever. No, I don't have the idea of that.
Anxiety and apprehension over the disease seems to have died down, even with the federal government's sponsored awareness campaigns. However, Dr. Bamidele Mutiu says more needs to be done to ensure that future outbreaks can be effectively tackled.
To understand Nigeria is prepared, only that the level of preparation is concentrated in some tertiary hospitals. For now, the only designated Lassa fever center in Nigeria is in only one state, which is an anomaly. Ideally, every state should be able to boast of a center that can easily handle outbreaks.
He emphasized that medical practitioners also have a role to play in ensuring that in the event of an outbreak, casualties can be reduced to a minimum, if not totally avoided.
For every medical practitioner now, what I always tell them, if I have any opportunity, is that, look, you are the one that lives within the community. You have a role to educate those within your environment. In my own church, I tell them, once there's an outbreak, this is what you should do, this is what you should not do. Everybody should be the one educating those within its environment. So you are more or less the missionary, the medical missionary to those within your community. You start from that. Then secondly, we should upgrade our medical knowledge, our training.
In the event of an outbreak, how prepared is the health sector? And as individuals, what should Nigerians do to prevent contracting the disease?
There are so many training facilities, so many seminars. We should avail ourselves of them. As far back as 10 years ago, I've been involved in viral hemorrhagic fevers, but I've never seen any Ebola patient until 2 years ago. When the opportunity came, I volunteered myself because it was an opportunity to be trained and to learn about new events.
There have been no recent occurrence of the disease, but the spate of occurrence of viral diseases in the continent, with more than 11,000 lives lost, to Ebola alone is clear indication that the federal government cannot afford to neglect the health sector if it is to avert a major catastrophe in the future. Henry Williams for Love World Plus News.